What is your A1C? What should your A1C levels be? So let's dive in and explore the ideal A1C targets for various age populations. Hello there. This is Dr. PK from Dr. PK Live. Today I'm going to discuss a very important topic about diabetes mellitus, and that is a blood test called hemoglobin A1C. So if you're a diabetic patient or if you know someone in your family who has diabetes, you must ask this question. What is your A1C? A1C is a test we do on regular basis to determine how well is diabetes controlled. Diabetes is complex condition. It requires careful management to maintain optimal health. And one key aspect of diabetes management is monitoring A1C levels. And this is crucial for individuals of all ages living with diabetes mellitus, either type 1, type 2, or gestational. A1C test provides a snapshot of your blood sugar control over the past 3 to 4 months. It's a vital tool in the diabetes management toolkit. But what should your A1C levels be, and how do these targets change across different age groups? We are going to discuss that today. Diabetes mellitus management requires careful attention to A1C levels for individuals of all ages. But what should these levels be, especially when treating a diverse population? And in this video, we delve into the optimal A1C levels for effective diabetes control across different age groups. Whether you are a patient, caregiver, or healthcare professional, this guide will provide you with comprehensive information to help you understand the significance of A1C levels in managing diabetes mellitus. So let's dive in and explore the ideal A1C targets for various age populations. Understanding A1C and its role in diabetes management. Before we delve into the specifics of A1C levels, it is important to understand what A1C is and why it plays such a crucial role in diabetes management. So what is A1C and why it is important? A1C, also known as HbA1c, hemoglobin A1c, is a form of hemoglobin, and hemoglobin is a protein in red blood cells that carries oxygen. And the A1C part of the term refers to a specific component of hemoglobin, and this component can become glycated or coated with sugar when blood sugar levels are high. And simple analogy I can give you is this. It's just like a sugar coating over the donut. Thicker the sugar layer, thicker the sugar syrup, the thicker would be the sugar layer over the donut. But of course, it is more complex than that. A1C test measures the percentage of glycated hemoglobin in your blood, and this gives an overview of your average blood sugar levels over past 4 months, which is the lifespan of red blood cells. So how the A1C test works? A simple blood test. It's often performed in a healthcare provider's office or a lab, and this test measures the amount of sugar attached to the hemoglobin in your red blood cells. The higher your blood sugar levels, the more sugar will be attached to the hemoglobin, and this is why A1C test is such a valuable tool in diabetes management. It provides a long-term view of your blood sugar control beyond the immediate snapshot provided by daily blood glucose testing. So what's the recommendation for A1C levels by age group? When it comes to managing diabetes, one size does not fit all, and this is particularly true for A1C targets, which can vary depending on a person's age, overall health, and other factors. Most patients, a reasonable goal of therapy for most non-pregnant patients is a glycated hemoglobin value of less than 7%. As per Diabetes Control and Complication Trial, United Kingdom Prospective Diabetes Study, UKPDS, in which a line assay in which the upper limit of normal is 6%. And in order to achieve the A1C goal of fasting glucose of 80 to 130 milligram per deciliter, that is 100 ml of blood, and a postprandial glucose, which is post-meal glucose, taken 1.5 hours to 2 hours after a meal, being less than 180 milligram per deciliter, are typical targets. But higher achieved glucose levels may suffice. And the A1C goal of less than 7% for most non-pregnant patients is consistent with guidelines from the American Diabetes Association and European Association for the Study of Diabetes, EASD. American College of Physicians recommends a higher A1C target of 7 to 8% for most non-pregnant adults. And for most adults with diabetes, American Diabetes Association, ADA, recommends an A1C A1C target of less than 7%. And this target can help prevent complications related to diabetes, such as nerve damage and heart disease. Of course, this target isn't right for everyone. Some people may need a higher or lower target depending on their health, comorbid condition, and lifestyles. So, what is the A1C goals for children and adolescents? Children and adolescents with diabetes have different A1C targets than adults. The ADA recommends an A1C target of less than 7.5% for this age group. And this higher target takes into account the unique challenges of managing diabetes in children and adolescents. And these include the risk of hypoglycemia and the changes in blood sugar levels that can occur during growth and puberty. A1C consideration for the elderly. Older patients or those with complications or comorbidities. The A1C goal should be set somewhat higher, 8% or higher, for patients with a history of severe hypoglycemia, or patients with limited life expectancy, or very young children, or older adults, and individuals with advanced complications or comorbid conditions. American Geriatric Society suggests an A1C target of 8 to 9% for older adults with multiple comorbidities or limited life expectancy. And these recommendations are supported by a decision analysis demonstrating that comorbid conditions and functional impairment better predicted both shortened life expectancy and reduced benefit from intensive glucose management than age alone. And it showed improved glycemic management lowers the risk of microvascular complication in patients with type 2 diabetes. However, the absolute risk of microvascular complications and the incremental benefit of intensively lowering A1C must be balanced against the diminishing returns and the heightened risk of hypoglycemia at A1C levels less than 6.5%. Thus, all clinical practice guidelines recommend tailoring A1C levels for individual patients.